Hey fellow lab rats, this is Rebecca from the Lab Rat YouTube channel. In this video, I'm going to be discussing enzyme deficiencies that can lead to hemolytic anemias. Alrighty, let's get started. Glucose 6-phosphate dehydrogenase, or G6PD, is an enzyme that protects the red blood cell from being prematurely destroyed. G6PD deficiency is actually the most common type of enzyme deficiency. It's genetic and X-linked, mainly occurring in males. And the reason for that is that it is X-linked. So what it means that the mutation is in the gene on the X chromosome. So genetic males have one X and one Y chromosome. So if a genetic male inherits the mutation on the X chromosome, there's only one X chromosome that's going to be expressed. And if they have that mutation, it's going to be expressed. So if a genetic female has that mutation, so they have two X chromosomes, so one X chromosome would have that mutation and the other one in theory would be normal. So it would not be expressed because the gene is recessive. So this is why we usually only see it in genetic males. In females that have the deficiency, there are two red blood cell populations. So one population is normal, created from that one X chromosome that's normal, and then the other has the G6PD deficiency created by the gene that's on the X chromosome that is abnormal. So the World Health Organization, or WHO, rates the G6PD deficiency on a scale of 1 to 5, 1 being the most severe and 5 being the least severe. At the time of this lecture video, around 400 million people worldwide have this deficiency, with it being most common in people of Mediterranean, African, or Chinese descent. This deficiency also comes with partial protection against malaria, which is an intracellular blood parasite. Patients that have a deficiency of G6PD have intravascular hemolytic episodes when they are triggered by a certain type of exposure. And I'll talk about these exposures on the next slide, but basically 1 to 3 days after a patient is exposed to either an oxidative drug or fava beans, they will have intravascular hemolysis. So this leads to a chronic hemolytic anemia. Babies that are born with this deficiency will frequently have jaundice. And this makes sense, right? Because the red cells are breaking down, they're releasing their hemoglobin, and that hemoglobin is getting broken down into bilirubin. So there's going to be extra bilirubin present in the bloodstream, and that is going to cause the patient to be jaundiced, which is having a yellowish or greenish tint to the skin. So what causes these intravascular hemolytic episodes? So eating fava beans. So these beans contain high levels of glucosides, and when those glucosides are broken down, they can damage the red blood cell when there's a deficiency of this G6PD enzyme. So patients that have this G6PD deficiency should obviously stay away from those beans, and those beans are actually pictured here on the right-hand side of the slide. Certain oxidative drugs can also cause patients with G6PD deficiency to have hemolytic episodes. So these drugs include antimalarials, which are taken to prevent malarial infection, sulfonamides, sulfones, nitrofurans, which are all antibiotics, and also certain analgesics, which are used to provide pain relief. So all these drugs can cause episodes. Patients with a G6PD deficiency will usually be asymptomatic until they have an exposure. Since this isn't constant hemolysis, so it's only occurring when there is an exposure, usually the bone marrow is able to compensate for the blood loss when an episode happens. So obviously the treatment for these patients is to have them avoid oxidative drugs and fava beans and provide them supportive therapy like blood transfusions when needed. This disorder is usually not life-threatening, especially when supportive therapy is provided. After an episode, we as medical laboratory professionals will be able to see the effects of the hemolysis. So bite cells can be present in the peripheral blood smear. So I talk a lot about bite cells in my red blood cell morphology lecture. If you haven't seen that already, go check that video out. So bite cells are visible using a Wright stain, which is what we use for peripheral blood differentials. So when using a supravital stain, the bite cells will be revealed as something we call Heinz bodies. So this picture here on the right-hand side shows a great representation of that. So again, the marrow is doing as much as it can to try to produce more red blood cells to replenish the bloodstream. So it's making more red cells to compensate. With that, you will see increased reticulocytes. And of course, red cells are being lysed open, releasing hemoglobin. So we're going to be seeing an increase of free hemoglobin in the bloodstream. We may also see it in the urine as well. And of course, this is a deficiency of G6PD enzyme. So there will be an abnormally low level of this enzyme in the bloodstream as well if we do tests for it in this patient. So there are a few tests that can be performed to test for G6PD deficiency. There's a dye reduction test. So if the patient has normal levels of G6PD in this test, NADP is reduced to NADPH, which reduces a blue color to a colorless form. So if the blue color remains in the sample during the test, that means there is a deficiency of G6PD. There's also a fluorescent spot test. The patient's blood sample is mixed with G6P, NADP, and saponin. And if there's a fluorescence in the sample, this is normal. If there's no fluorescence present, that patient has a deficiency of G6PD. There's also an exorbate cyanide test, although it's not incredibly sensitive for G6PD. So the best method for testing for this deficiency is through polymerase chain reaction or PCR testing. Now, pyruvate kinase or PK deficiency is a rare genetic disorder that causes a deficiency of the PK enzyme. So this enzyme helps to regulate the metabolism of the red blood cell. So deficiencies cause the red cell to be super rigid, causing decreased survivability, which in turn causes them to lyse prematurely. And this is why it causes hemolytic anemia. Echinocytes or Burr cells are common in the peripheral bloodstream in patients that have PK deficiency. These are red cells that have short blunt projections that are regularly distributed around the surface. So sometimes these cells can be an artifact on the slide, meaning they are caused by an issue with how the blood was smeared on the slide or how the smear dried, and not actually present within the patient. If they are actually present in the patient's bloodstream, they can be from, of course, PK deficiency or something called uremia, which is when high amounts of urea build up in the blood, usually caused by renal failure. Treatment depends on the severity of the pyruvate kinase deficiency. Blood transfusions can be given to replace red blood cell loss. Sometimes a splenectomy may be indicated, so the red cells are going to be destroyed in the spleen, and in excess there's going to be an enlargement and issues within the spleen, which may cause the need to remove that organ. In the laboratory, patients are going to have normochromic normocytic red blood cells, anisocytosis, so an increase of RDW, which is a varied size differential between the red blood cells. This can be seen. Poikilocytosis, which is red blood cells of various shapes, and polychromasia can be seen in the peripheral blood smear. And polychromasia retics will be present because the bone marrow is making more red cells to try to compensate for the blood loss, and it's churning out red cells as quickly as possible. Red cells are, of course, getting lysed prematurely, releasing hemoglobin, and when these red cells are lysing prematurely in excess, there's going to be free hemoglobin present. And that hemoglobin gets broken down into bilirubin, so bilirubin is also going to be increased in patients that have hemolytic anemia caused by a PK deficiency. The osmotic fragility test is a test where the patient's blood cells are put into a hypotonic solution, and weakened red blood cells are more likely to break in this solution, and this test can help determine if a patient has a red blood cell disorder. So patients with PK deficiency have a negative osmotic fragility test. There are some other enzyme deficiencies that can cause hemolytic anemia. A deficiency of glucose phosphate isomerase can cause it due to unstable mutations. A deficiency of the enzyme hexokinase can lead to hemolytic anemia, as well as deficiencies of phosphoglycerate kinase and triose phosphate isomerase. all of those, in addition to G6PD and PK deficiency, can cause or lead to a patient to develop hemolytic anemia. Okay, that's it for this lecture. If this video helped you, go ahead and give it a like. Please leave your comments if you have any questions below, and please subscribe to the channel for more educational laboratory content. Alrighty, until next time.